So I'd like to invite now the next table, self-test in the theory to practice. Moderator will be Pamela Gaspar. She's a pharmaceutical biochemistry and has a doctorate in public health. She's working for some years in the development of public health regulations and also the implementation of self-test in Brazil. She's in the General Coordination in Infection Department. So Pamela, please, you can start. Thank you. We can hear you, Pamela.
Estão me ouvindo agora?
Can you hear me now? Yes. Okay, thank you. Sorry. So hello again. Good afternoon, everyone. So first of all, I'd like to thank you for inviting me and the participation of all of you in this important event that's discussing the self-test to broaden the access to diagnosis and self-care. So to our first presentation, I'd like to invite Dr. Marcos Paulo Barbosa Juca. He's a pharmacist, microbiologist, and a master in material engineering. He works in vitro management and the National Department of Healthcare. So you're welcome. Thank you. Good afternoon, everyone. It's a pleasure to be here with you in this webinar. Just let me be sure that you can see my presentation. We can't see yet. Now you can. It's in presentation mode, right? Yes. So it's a pleasure to be here with you. Today I will have an approach from the regulation side, from Anvisa side. So the risk of the products and the self-test in Brazil. So I'll talk about the history and the current situation. Aligned with the previous presentation from our friend from FDA that checked the risk and the benefits of the new technologies. Just a second, I was not able to go to the next slide. So I will use RDC 36 from 2015. That's what the legislation that we use now, it's being revealed, but this is what we use. So the self-tests are possible to be used in Brazil since before this. But the guideline that we have for the general record for in vitro diagnosis is the same one for the self-test. So I use the definition for the self-test in Brazil. It's a product for the follow-up of the conditions of a disease or to detect specific condition, where the idea of helping the patient, but it's not useful for diagnosis, can be done for any person or health professional or by a lab. Just to highlight here that we cannot use for diagnosis is not a conclusive information for diagnosis. So a self-test needs to be confirmed with a professional test for a final diagnosis. So according to the RDC 36, the current rule, all the products for self-test in Brazil needs to fulfill some requirements. Some of requirements are common to other professional products, and some are specific for self-test. In the common requirements, we have the development, the performance of the product, specificity, sensitivity, cutoff, proton effect, accuracy, precision, interference, and stability studies that are important in a country that is so big as Brazil. We have, in the state, we have different moisture, different temperature in different states in the country. So we have this use, the transportation and storage, and also to validate the procedure and cleaning if we have some equipment being used for the tests. Besides these common requirements that are the same for other tests and also self-tests. Some are specific for self-tests. So we have the usability study and risk management. This is the main difference for regulation of a product that maybe can be similar or identical to a professional test. But the manufacturer needs to pay attention for the usability of the product. We need to be sure that any user from different age range with different socioeconomic condition and also knowledge can do the test and get the same result as a professional person.
So the usability study and risk management towards risk related to a layman user, the environment outside clinical labs, the environmental conditions for this use, they are very important tools so that Anvisa can evaluate if the management, the risk management is able to reach the risks related to its use by a layman user. But we are still in 2015, so RDC 36 still has some issues. Not all products can be registered as self-tests in Brazil. The most common ones are glucose, ovulation, cholesterol, HCG, HIV. So this is something that is already commonly used in Brazil. And why is it not open for everyone? RDC 36 has some specific areas. So blood type, identification of drugs and metabolics cannot be self-tests, just like genetic testing, tests for compulsory notification, which can identify um, communicable diseases, which is the case of COVID, also cardiac or tumoral markers, and they're not used for diagnosis. The HIV self-tests, they are allowed in Brazil because still in 2015 with RDC 52 in 2015, there was already a policy that was related to self-tests, like my colleague from the health ministry has already presented, and it's a specific standard which considers the regulation of self-test products for HIV. Until the beginning of 2022, this didn't exist for COVID-19. So there was a change in the scenario. We reached 2022, and at the beginning of the year, the health ministry, through the national plan of expansion of tests for COVID-19, PNE test, got the self-test introduced for COVID-19, specific for COVID-19, because until then, the self-test tool hadn't been presented on the national test for test expansion, on the national policy for testing in Brazil. From there, in January 28th, 2022, Anvisa was able to publish the RDC 595, which is a resolution, and that opened the possibility of having self-tests for COVID in Brazil. Now, with the self-test available in Brazil, the definition that was given by RDC 595, I'm going to read for you. Medical device for in vitro diagnosis destined for the use of a layman user on themselves, based exclusively on the instruction supplied by the manufacturer. That's what RDC 595 from 2022 brings. So now we have two current RDCs, 36 in 2015, which is general for self-testing, and RDC 595 for 2022, which specifically talks about self-test for COVID-19. So thinking of how easy it is to use and the risk-benefit ratio, some measures were adopted for 595 2022. So the target is always antigen. Sample is always a nasal swab or saliva. You can see that it's always a nose swab, which is easier to collect. It's more simple and it's also quicker to sample, and it's not as hard for a layman user. Methodology is always immunochromatography, which is qualitative. So one step, you don't need sample processing, and you can reduce the error rate. Minimum performance for sensibility and specificity, respectively. Sensibility 80%, specificity 97%. And I should highlight that 100% of the tests are verified before authorization. This is a previous analysis done on INCQRS. It's an official Anvisa lab that tests 100% of the products before the authorization of sale that they have. As we said, the goal is triage. It's mainly for guidance. And there are some requirements for use, which is when to use the product, what are some preventive measures for the for getting COVID-19, which is specific for Brazil, pictures that are going to show the user to understand how to do the test, what do you do in terms of when you get the result, and the access to a number to call and report results. I'm going to show a little bit about the scenario for distributions of the products, about the effort that Anvisa had to make this available as soon as possible and bringing products that have the minimum requirements that were established. The entire technical team for management of in vitro diagnosis has been focusing on the analysis of the processes related to facing the COVID-19 pandemic. Ever since the beginning of the pandemic, we already had over 1,000 evaluation processes submitted. For self-test processes, we had 105 products. The first regularized for self-test was February 17th, 2022. So the first standard was for January 28th, and then February 17th, that first product was already ready to be sold in Brazil. The total submissions was 105 until today, which is March 31st, 2022. And the total of requests that were approved was just 16, and not necessarily are different products. The Brazilian legislation allows for the same product to be sold with different names. Now I will show you a chart. On this first column, we have the total of processes or products that are waiting for analysis. So they are waiting for analysis. We have just over 40 products in this situation. Just over 40 processes already had their analysis completed as well, and they already had a definition of approved or not approved. And around 25 or just over 25 are part in technical requirements. So we need to explain a little bit more about what leads to these processes to go into the technical demand or the ones that are not approved. And on this other slide, I can show you the completed analysis that are already made public, that we already published the results from Anvisa. In blue, we have 41% of products approved from the total of products that were already analyzed. In orange, we have 59% of products that were not approved, products which we did not approve the process. Here, I'm going to give you a quick explanation as to why these products are maybe not approved. Why were they not approved? Most cases for this one, it's not related to performance of the product. It's not related to sensibility, specificity, or how it can be repeated, or any tests related to performance of this product. Usually, these are related to usability, risk management, and use instructions. As I said at the beginning, usability is very important. Specifically, the manufacturer needs to call the product self-test. So that's the responsibility of the manufacturer. They need to be able to see and identify the errors related to the use. So the usability needs to be seen so that we can find whatever errors that they may have, like not reading instructions, not reading instructions correctly, or maybe getting the sample in the wrong place, identifying the test device where the sample is. If the sample needs to be diluted, where are the test lines? So the usability study is the biggest reason for why products are not approved. Use instructions are also another big reason for why products are not approved, especially when we have imported products and we translate the instructions. However, we do need to mention that the health policy, the national health policy, there are requirements that are specific for Brazil, like guidance in preventing COVID-19, our number to contact the health ministry to be able to guide people about the tests. So this information has to be on the use instructions. And also the language that needs to be simple and accessible, and needs to be understood by anyone, teenagers to elderly citizens, with information for any type of social economical situation. So this is very carefully looked at by our technicians, risk management as well, and usability cases. So these are the main cases that lead to a not approval. I should also mention that Anvisa registering devices for in vitro diagnosis has an educational product, an educational project. So all the yellow side, everything that was not approved, 59% that was not approved, all of this 59 received information. They all received information, whether they are a manufacturer or if they are importing things, they received their detailed reason for why they were not approved. So they could improve their request, or they could have failures or challenges that weren't done on risk management, and maybe failures or non-conformities other than performance deviations. Anvisa as a whole has been showing that there is improvement in process quality in the submission of new products. So we hope that this number reduces, and processes that are defined and that are according to that are more than the processes, than the general amount of processes. And as I said, in most cases, this is not related to the lab performance. So it's not necessary to have a design rework or process rework for the actual manufacturing of the process or the product. But we need to be careful about the risk related to the user. We see the Power BI with the products that were regularized. So we can see all products that were done for COVID-19. We have a panel for the ones that are for auto test for COVID-19. And for all products, we have the daily update that is very transparent and very dynamic. So we can see that manufacturers and general population can follow the situation of the submissions if they are being done, if they're waiting for technical documentation, or if they're waiting for any extra things that Anvisa may have required. With that, we want to have transparency and agility for the manufacturers and everyone that is on the registry process. Thank you so much, and I am here for any questions that may come up. Thank you so much, Dr. Marcos Juca, for this great presentation. Thank you for telling us Anvisa's norms about self-test and also giving us a general view of the tests approved in the country. Congratulations for the work you've been doing in Anvisa and for searching for safe and quality tests. So anyone, if you have any questions to Dr. Marcos, please ask your questions in the chat for the Zoom Q&A function. For the next round, I would like to call Cassiano Correr. He is a pharmaceutical, he's a doctor in internal medicine and the service platform. He's a technical consultant for Abrafarma, which is the Brazilian Association for Pharmaceutical Networks. Dr. Cassiano, welcome, and you have the floor. Thank you so much, Pamela. Good afternoon, everyone. It's great to be here. Thank you so much. I would like to thank Carlos for the invitation and say congratulations to everyone and to all the panelists that came before me. They were great, really great. I want to share my screen with you. You can see that, right? Yes. Okay, so I'm going to have a view from the pharmaceutical point of view, like Pamela mentioned. I work with Abrafarma, which is the Brazilian Association for Pharmaceutical Networks. I also work in health technology, specifically with Clinicar, which is a health service platform for pharmacies and offices. And I'm going to give you the experience with the COVID self test.
In the point of view of the drugstores, to give an overview, since 2020, since April of 2020, the drugstores are doing the COVID test since the beginning of the pandemic in Brazil. More than 4,000 drugstores providing the service for 2 years since Anvisa authorized the tests in the drugstores in Brazil. And this only in Abrafarma, that's the association for the big companies. So we have more than 16 million tests in Brazil. And we have the images to remember about these people that were working there the last 2 years. And also the pharmacies they have provided to the society, not only to the press, but the public opinion and only also public health authorities about the behavior for the COVID tests from the testing being done in the pharmacies. We have a lot of weeks in a row that we manage and we monitor the results of these tests for antigen and antibodies. And this curve that I bring to you, it's a historical view since the week 95. That's the week that we are now. That shows a similar behavior to the waves that we have seen in Brazil. So this is an important thing that the pharmacies did in Brazil in the last 2 years. And we had some studies that were published last year. So when we had the Delta variant, we analyzed more than 3,300,000 tests done in the pharmacies in the first quarter of last year. Besides the information regarding symptoms that were reported by the patients in these pharmacies, and we published this, not showing the system and the different characteristics that the disease presented clinically as the population, the range of population, and also the quick tests in pharmacies. So this is the side of the pandemic that we know so far. For the pharmacies and the country, we consider that we are in the fourth generation of the quick test that we have started for the first the antibody, then antigen, and then for anti-spike antibodies, and now the self-tests. That's the topic here of our discussion today. The self-tests goes to the drugstores, as we know, and with the self-tests in the drugstores, in the pharmacies, and obviously we didn't have the end of the pandemic, but we have the situation right now. The question is, in the practice, how can we help people? How can we help the population to get these tests and they can do the test in the proper way, can understand the results, to do what they need to do. And I bring here what people are saying and how they're doing this. And we're talking about the beginning of this process once that the first self-tests of COVID in the pharmacies in Brazil, it has been for 3 or 4 weeks. So one side I'd like to highlight is that the same way that the pharmacists and the people that are there in the pharmacies, the health professionals that are there and they used to do and they're still doing the tests, the professional tests of these patients, the same way the pharmacists are available for these patients that get the test there to guide them about the best use of the self-test and to highlight that the journey of this patient that gets a self-test, it's a journey that this person needs support and needs resources. Even though the self-test is simple, it is quite simple. It's important to have the resources available for these patients. And the patients, they're going to go through this journey and they will have some questions, especially in a country as Brazil, as we have so many differences in illiteracy, in socioeconomical points. So if there's difference between the tests, what to do if it's positive, what to do if it's negative, about the self-isolation, about the notification of the result for the people that this patient was together, and the use of self-test. That's more indicated with a health professional. In some cases, self-test is enough. Looking at this scenario, an important innovation that we have is what we call the digital journey of the self-care. What does it mean? Once that this person buys the self-test, we understand that the journey of self-care is not going to stop there. We understand that it's possible and we need to do this. We need to create channels, to create mechanisms so the patient can receive orientation, can get the best information in the best format as possible to make the best decisions for their own health. What we have done is to create a digital journey that follows the physical journey, as we call. So in the box for the self-test, I'm showing here a specific brand, but could be other brands. We have a QR code, and this QR code we understand as a link, as a channel, which the patient can go through a digital journey. So after buying the test, this patient will read the QR code in the box with the cell phone, with the smartphone. It goes into an app, an online app that's for free, that's part of the service of the self-test, and they can be guided in this step by step of how doing this. I will show more details to receive personalized orientation using algorithms from the app according to the recommendations and protocols that we have from the health department in Brazil, and also give the opportunity for this patient to know what to do next. I will talk more about this, about having access to a physician and when the test is confirmed in the pharmacy. Going into details of how we can guide this patient, I brought here as an example to show we have some screens how this app works. So one side of this is like a label, and better than read a paper, you can be guided with images. We have different images showing what is the best procedure to take that test. We can see in this app what you're seeing there. If you see just one bar, if you see two bars, and the question sometimes from the patient if it's the bar is a little bit lighter in color or darker. So the app can help this patient to see and understand this result, if it's positive or negative, and be able to ask to this patient if this patient has some symptoms, if it's an asymptomatic patient, and based on that, build scenarios to guide this patient. We've been used the name of result card to see that there's a delivery of this result, that the patient built that in the self-test. And this patient, once that has the result, he can storage, the patient can storage this. The patient can act, as we say, because after this orientation, the patient can go through self-isolation, can notify other people. The patient can share this result easily through an app, can share with the physician, with family, with friends, or even social media if that's the case, to say that the person took the test and what was the experience and what was the result. If the patient understands that needs another test to confirm, the app can guide the patient or to get a clinical paper to present or to go an event that needs to present this report. So this clinical report. So this patient can, on this app, find pharmacies close to the home where the patient can find this self-test, this antigen test. And in other cases, especially when this patient has symptoms, a more moderate case, and the patient is more worried, is not feeling well, and take the test and it's positive, the person can have a medical consultation, an online check. It can check with the physician online through the app. So what we are talking here is a journey, not only guide the patient to take the test in the proper way, but to understand the result and help this patient to make decisions of what to do. And this is an interesting experience. And we are in the beginning of that, a little bit more than 3 weeks that the first test started being sold in the pharmacies in Brazil. But we have thousands of patients that used this. The numbers are not completely available of how many self-tests were sold in Brazil. But regarding distribution, we have manufacturers that inform that more than 1 million self-tests were distributed. So probably we have higher numbers than that in the entire country. And as the population is using these self-tests, we can get all the data to understand what is the behavior of this patient in this self-care journey. What I bring to you of the first numbers, it shows the percentage of people that's using the online part, using the app, using the QR code of the box. So it brings the information that we can have here in a voluntary way. And we see that we have interesting distribution between men and women. So almost the same thing, 52% women. Of all ages, we have from 14 years old to over 80 years old. So it shows as self-tests can be more democratic because it doesn't have a specific age to use. And we have the states that have more people where we receive more results, so that we have more people using. It's the case of São Paulo state, Rio Grande do Sul, Minas Gerais, and Paraná in this order. Besides that, something that got caught our attention, and the data that I will show, it doesn't have a epidemiological characteristic, is just it's a bias because I'm looking at the results that from the patients that use the app from the QR code. But it's interesting to see that the majority of these patients, they show positive results for this self-test, 79% positive. It's this rate, it happens in all states, as you can see in the chart on the table here on the right side. All the states that has a more relevant of patients reporting this. Obviously, is a biased result, but it shows a predisposition for the patients that that have symptoms. So they look for help if the results are positive, and the app is something to support in this self-care journey. Besides that, going towards the end, I'd like to use the opportunity to provide something that from Abrafarma and CBDL that are building together that's related to the self-test initiative called myselftest.com.br. It's a website that will be launched in the next days. It's for general public, and it's a website that the goal is to inform, to have important guidelines how to use the self-test, what is it for, when to use it, and to help the population to find the reliable information in a fast way when they are searching this in Google, for example. But also this page from Abrafarma and CBDL, it's going to be something where we're going to have a link that the manufacturers of self-tests can inform the results that they are getting with these self-tests regarding the reports of the results. As we know in Brazil, from the RDC, about the information about the self-tests is something that the manufacturers will decide if they provide this for the patient to give the results and all of that. And the idea is to try to consolidate, to find a path to consolidate this information, to report this data to the authorities in the public health system of Brazil. And the tests from the professional tests, they have this. So we understand that, so not just an individual data, but as a barrier to provide a barrier for the virus, and also generate information that can be used for everyone. That's what I'd like to bring. I hope that I have brought important information to the participants, and thank you for the opportunity of being here.
Thank you so much, Dr. Cassiano. Your presentation was great. Very relevant. The contribution of pharmacies was very relevant as a health establishment working towards ending COVID. And an example of the innovations that were shown with testing in the digital world were very interesting and very inspiring for other initiatives. And it's more and more needed in this technological world. Thank you so much. Before we finish this panel, since our topic is from theory to practice, I would like to read something from someone from London. And this real life deposition really is really connected to what Dr. Rosanna Peeling brought at the beginning of the event. So this is the report. Having the antigen test to take at home allowed me to feel more confident to meet friends and family members, especially elderly people, knowing that with the negative test, the chance of transmitting the virus for my family members is very small. Other than that, having tests more frequently, regardless of the COVID symptoms, allowed all of us to do our part and contribute to reduce the spread of the virus. Having tests available at home made everything quicker and easier, giving us the flexibility of testing according to our convenience. This is something that we saw with what Mariana said as well, wherever I want, whenever I want, with people I trust. So to close, I would like to leave just a reflection on this deposition and how what we said in this panel and it's representative to all of us so that we can make sure that this is also something that can be said by people all around the world and related to other si- diseases as well, like HPV, HIV, HCV. So thank you so much. And now let's go back to Carlos. Excellent, Pamela. Thank you so much. I would like to thank Marcos, Juca, and Cassiano. All the presentations have been very important and very timely as well to bring another view for the health sector. I would kindly ask Cassiano and Marcos Juca to answer the questions in the chat as well as on the Q&A functionality. All of those who want to bring new challenges and new points of view, please do so. Unfortunately, I have to go because I need to respect our international speakers who are in Europe and they are actually 1 hour later than what we had planned because of the changes in daylight savings time.